Welcome to Ragsmed. Today we'll be studying necrosis, which is a type of cell death. As we know that cell death is of two types, that is apoptosis and necrosis. In previous video I have already discussed about apoptosis. So let's start our today's topic, that is necrosis. So necrosis is a death of cells and tissues in the living animal. Necrosis is defined as a localized area of death of tissue followed later by degradation of tissue by hydrolytic enzymes liberated from dead cells. It is invariably accompanied by inflammatory reaction. In apoptosis, caspase was the enzyme which got activated and degraded the cell into apoptotic bodies, whereas in necrosis, hydrolytic enzymes will get activated, which will cause the degradation of the cell. From bursting of a cell, here leakage takes place and inflammation also takes place. But in apoptosis, there was no leakage, so there wasn't any inflammation. So the thing we should remember is that necrosis is usually affects a group of contiguous cells in contrast to apoptosis, which involves only a single cell. And there are inflammatory changes in the surrounding tissue in contrast to apoptosis, where there is no inflammatory changes. Now let's come back to types of necrosis. So what are the types of necrosis? Types of apoptosis we have already discussed that there are only two types of apoptosis, that is physiological and pathological, but necrosis is always pathological and it is of 5 types. That is, number 1 is coagulative necrosis, which is the most common type. Second is colliquative or liquefactive necrosis. Third one is gaseous necrosis. Fourth, fat necrosis, and fifth is known as fibrinoid necrosis. Now before going into the details of the following types of necrosis, first let us see some terminology associated to the cell. So here we can see a cell. So there are 3 criteria known as architectural details, cytoplasmic details and nuclear details. Architectural details means the outline of a cell. Cytoplasmic detail means some cells have blue or pink colored cytoplasm, few have granular or few have agranular cytoplasm. So cytoplasm of a cell is different, known as cytoplasmic detail. And in nuclear detail, we can see that some cells are circular, some are oval, some are dark colored, some are condensed. So various cells have various details, and by looking at these 3 types of detail, we can determine which type of cell it is. By looking the outline, that is shape of a cell, cytoplasm, that is color, granular, nucleus. In nucleus also its color, granule, shape and position. So by looking at these 3 features, we can decide the type of a cell. So human bodies have different types of cell. These are known as muscle cell, intestinal cell, fat cell, neuron, red blood cell, monocyte, basophil, lymphocyte, eosinophil and neutrophils. Now let's come to the number 1 type of necrosis, which is the most common type, that is coagulative necrosis. So first let's see its introduction. It is the most common type of necrosis, and here the architectural outlines persist but cellular and nuclear details are lost, also known as ghost cells. The type of tissue can be recognized here. The denaturation, that is coagulation of structural and enzymatic proteins, block proteolysis. So here we can see the normal cell is changed into the coagulative necrosis which looks like a ghost cell, or also we can say it as tombstone. So here we can see the cellular and nuclear details are completely lost and only the architectural detail, that is outline of a cell, persists. Now let's see the causes of coagulative necrosis. So the number one and most important cause of coagulative necrosis is ischemia, which means lack of blood flow, and it is due to thrombosis or embolism in many organs except brain. In brain there is no coagulative necrosis, only liquefactive necrosis takes place in brain. Amongst solid organs, brain is the only exception. That is, it is the only solid organ in which ischemia leads to liquefactive necrosis and not coagulative necrosis. Second cause is mild burns, that is thermal injury. Third cause is Jenker's degeneration necrosis. Grossly, we can see focus is the early stage, is pale, firm and slightly swollen. With progression, the affected area becomes more yellowish, softer and shrunken. Here we can see the gross view of liver, and here this area is necrosed, showing coagulative necrosis, and it is pale and swollen. Here in kidney also we can see this area. Here the coagulative necrosis has taken place. Now microscopically we can see the hallmark of coagulative necrosis is the conversion of normal cells into their tombstones. That is, outlines of a cell are retained and the cell type can be recognized, but their cytoplasmic and nuclear details are lost. Number one morphological change that we can see is that tombstones, that is outlines of a cell, are retained. Second, the necrosed cells are swollen and have more eosinophilic cytoplasm than the normal. Third, these cells show nuclear changes of kinosis, karyorrhexis and karyolysis. Fourth, eventually the necrosed focus is infiltrated by inflammatory cells. Here you can see the diagram of kidney. In the left side we can see this is the normal kidney, and in the right side you can see the coagulative necrosis. Now compare the cells on both sides. In the normal cell we can see all the three details of a cell, that is architectural detail, cytoplasmic detail and nuclear detail. Here we can see these are the tubules and these are the glomerulus of a kidney. In coagulative necrosis, kidney, that we can see only the architecture of a cell. We cannot see the cytoplasmic and nuclear details of a cell. The nucleus has either absent or it is kinetic, and the cytoplasm is more eosinophilic. And at the junction, we can see abundant lymphocytes causing inflammation, which is a feature of necrosis. Now let's come back to the second type of necrosis, that is colligative or liquefactive necrosis. First, let's see its introduction. So, in liquefactive or colligative necrosis, the hydrolytic enzymes in tissue degradation have a dominant role in causing semi-fluid material. Their architectural details as well as cytoplasmic and nuclear details are lost. Here we can see the normal cell is changed into the liquefactive necrosis, and we can see the semi-liquid material is found in the liquefactive necrosis. So what are the causes of liquefactive necrosis? If any organ is infected by the bacteria, then with the help of the liquefactive necrosis, bacteria will kill the cell. So the number one cause is pyogenic bacterial infections, attract neutrophils. Bacterial and leukocytic enzymes liquefy dead cells and tissues. Number two cause is ischemic necrosis of brain. In the gross view, in liquefactive necrosis, we can see the affected area is soft with liquefied center containing necrotic debris. Later a cyst wall is formed. Now let's see this figure. So this is a brain and you can see here that this is a cyst, and inside a cyst, please appreciate liquid material here. So this is a liquefactive necrosis in brain. Now let's see the microscopic appearance of a liquefactive necrosis. Number one is that no architectural or cellular debris are visible in the area of necrosis. The necrotic area is usually appeared as a cavity containing a mass of necrotic neutrophils, bacteria and tissue debris. Third, the entire necrotic mass is surrounded by a fibrous connective capsule or cyst wall. Fourth, the cyst wall is formed by proliferating capillaries, inflammatory cells and gliosis. Here we can see this is a diagram of brain. On one side we can see a normal brain containing neurons, and on the other side we can see here that this is a liquefactive necrosis here, and at the junction there is inflammation. So this is the type of inflammation known as granulation tissue. All the neurons and cells have been disappeared in the liquefactive necrosis. We can only see a semi-liquid material, that is debris, which is the blue colored material. So these are the debris, blue colored one. Here, along with lymphocytes, macrophages, plasma cells and many blood capillaries are also present in the granulation tissue. So the form of inflammation is different in liquefactive necrosis, that is granulation tissue. Now let's see the third type of necrosis, that is caseous necrosis. It looks like cheese. So let's see its introduction. Dead tissue is converted into homogeneous granular mass resembling cottage cheese. Their architectural details as well as cytoplasmic and nuclear details are lost in the caseous necrosis. So in caseous necrosis, we can see the accumulation of amorphous, that is no structure, debris within the area of necrosis is formed. Here we can see the normal cell is converted into the caseous necrosis into many granular debris. So the cause of caseous necrosis is associated with lesions of Mycobacterium tuberculosis, syphilis and fungi, that is histoplasma and coccidioidomycosis. Now let's see its gross appearance. So the foci of caseous necrosis resemble dry cheese and are soft, granular and yellowish. This appearance is partly attributed to the histotoxic effects of lipopolysaccharides present in the capsule of the tubercle bacilli Mycobacterium tuberculosis. So here we can see the figure of caseous necrosis, that is tuberculosis of the lung with a large area of caseous necrosis containing yellow, white, cheesy debris here. This is the caseous necrosis. So this is the figure of lymph node. Here we can see these are the normal lymph nodes containing lymphocytes in the follicle, and here we can see these are the cases necrosis. There is no presence of any cell, only granular debris is present, and at the junction here we can see a special type of inflammation known as granulomatous inflammation containing giant cells and epithelioid cells and also lymphocytes. These small blue colored are the lymphocytes. Let's see the fourth type of necrosis, that is fat necrosis. Let's see its introduction. So the fat necrosis is a special form of cell death occurring at mainly fat-rich anatomic locations in the body. So what are the fat-rich anatomic locations? Those are the female breast, pancreas and mesentery. Death of adipose tissue in living animal is known as fat necrosis. So what are the causes of fat necrosis? Number one cause is pancreatic, that is acute pancreatitis, traumatic, that is of breast trauma, and finally it is infection of omentum or mesentery. So grossly we can see the fat necrosis appears as yellowish white and form deposits. The formation of calcium soaps imparts the necrosed foci firmer and chalky white appearance. Microscopically, the necrosed fat cells have cloudy appearance. They are surrounded by an inflammatory reaction, and the formation of calcium soaps is identified in the tissue sections as amorphous, granular and basophilic material. So here we can see the figure of fat necrosis in acute pancreatitis. The areas of white chalky deposits represent foci of fat necrosis with calcium soap formation, that is saponification, at sites of lipid breakdown in the mesentery. So these are the white chalky deposits represents fat necrosis. So in this figure you cannot see a normal tissue. This is the fat necrosis with cloudy appearance, and this is the inflammation. Mixed inflammatory cells are present here, such as neutrophils, lymphocytes, plasma cells and macrophages. Now let's see the fifth type of necrosis, that is fibrinoid necrosis. Let's see its introduction. So the fibrinoid necrosis is characterized by deposition of fibrin-like material which has the staining properties of fibrin. The fibrin-like material is deposited in the wall of blood vessels. So the causes of fibrinoid necrosis is that immunologic injury to vessel wall. Example, in immune complex vasculitis, autoimmune disease, Arthur's reaction, etc. Arterioles in hypertension or peptic ulcer, etc. Microscopically, the fibrinoid necrosis is identified by brightly eosinophilic hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by nuclear debris of neutrophils, that is leukocytoclasis. Local hemorrhage may occur due to rupture of the blood vessels. So here we can see the fibrinoid necrosis. This is the lumen of an artery. This is the tunica intima and this is the tunica media in the periphery, and the tunica adventitia is not shown here. So here in media we can see two things: the pink colored ribbon like material, this is fibrinoid deposition, that is fibrinoid necrosis, due to, you can see the inflammation. That is, all inflammatory cells are present here. So this was all about fibrinoid necrosis. Now let's see few questions. Number 1 is, necrosis with cell bodies retained as ghost cells is what? A. Coagulative necrosis. B. Liquefactive necrosis. C. Caseous necrosis. D. None. So what is your answer? Please comment down in the comment section. So now let us see question number 2. So all the following organs likely undergo coagulative necrosis except A. Spleen. B. Heart. C. Kidney. D. Brain. So comment down your answer in the comment section. So this was all about the topic of necrosis. Please like, share and subscribe my channel for more videos of pathology. Thank you.